welcome back. Today in this video, we're going to be talking about how to help your dog or cat recover from their spay or neuter surgery. Now, there is a lot to talk about as far as the benefits and cons of getting your cat or dog spayed or neutered. But today in this video, we're not really going to go over that. We're not going to, talk about when's the best time to get it done, why to get it done, why not to get it done. We're just going to go over, like, now you've decided to get it done and what you can expect from this whole process. So one of my jobs at the clinic is actually to give information to the people picking up their dogs and cats, basically giving them their discharge information. So I'm going to be covering that in today's video. And don't forget to hit that subscribe button so that you can be part of Happy Tails Clan, and also hit the bell so that you do get notifications as to when I upload more animal videos. So I actually got the idea for this video because I'm getting little Luna here spayed. We got one litter of Corgi puppies from Luna. Luna is 100% Pembroke Welsh Corgi, and we wanted to get one litter from her, basically all puppies that we were keeping and everything. But now she's back up to a very healthy weight, fully recovered, done nursing for quite a while now. So we're getting her spayed. And that gave me the idea to go over all this information with you guys. Alright, so the term spayed basically applies to females and usually means that their entire ovaries and uterus will be removed in the surgery. Now, neuter is typically used for males and means that their testicles will be removed. Sometimes neuter is used for both animals, but usually in clinics it's not, so that they can make different prices for it because it is a different type of surgery. And of course, it's the same for dogs or cats. It just actually depends on male or female. Now, there are a few extra things that you do want to be aware of when it comes to getting a female dog spayed. You want to make sure that they are not in heat, they are not pregnant, and they are not nursing. Now, with female dogs, you can get them spayed if they are in heat, but this creates a lot more risk and complications for the dog. So it's a lot easier for them if you just wait a few weeks and then take them in to get spayed. It's also easier for you because vets usually do charge quite a lot more to spay a female dog when they're in heat. And like I said, that's just because there's so many more complications to it, and the surgery even takes longer. Now, a dog or a cat can be spayed if they are pregnant. All of the puppies or kittens will be removed and the surgery will be completed. However, if your vet finds out that the dog or cat is pregnant in the middle of the surgery, then do expect to find a much larger bill when you go to pick up your pet. Not only that, the surgery is a lot harder on your pet. And just imagine the hormone change from all of that. So if it happens that your dog was in heat and you saw her get bred, take her right away if you've decided that this is the best choice for you. Don't wait a long time. Get it done as soon as possible. Call the next day and make an appointment because it's going to be a lot easier for your animal if you get it done right away. If they are much further along in their pregnancy, this is going to be a lot harder for them. Now, the other thing is that if your dog or cat has had babies, then you do need to wait until they are completely done nursing. It is actually a month till after they have completely stopped nursing that you can take them in for their surgery. Now, taking them in before that can actually cause a lot of complications because the incision can actually have milk leak into it from the glands, which, just causes a lot of problems and makes it a whole lot riskier. So just wait until they are fully done, wait, a month after that, and then take them in. And actually, most vets will turn you away if your pet is nursing. They won't perform the surgery. Now, with males, it's not so complicated. So when you've decided you're ready, make an appointment. It's a good idea to take off work from that day that you're going to be taking your pet in to get spayed or neutered. Make sure you're going to be around that afternoon in order to care for them and make sure they're feeling all right and that everything went well. So plan ahead and make sure you have time for it, and also time within the next following days. Now, it is okay to go back to school or work right after that and then come home and care for your pet, but just make sure you're not going to be out of town before your dog or cat's incision has healed, and then there's the possible risk of infection and even death. So just plan ahead of time. Get a crate to keep your pet in so that they have a nice clean area to rest while they're recovering from surgery. Now, with dogs, you definitely want to make sure that they're not running around and opening up their incisions. So crate's really important just to help them recover. Call your vet's office ahead of time and ask them if you'll need to make a follow-up appointment for your dog after the surgery. This depends on the clinic. For example, our clinic actually used dissolvable sutures. So once we discharge the dog or cat, they don't need to come back unless there's any sort of complication or if it was a special surgery. But for just your basic spay and neuter surgery, they don't have to come back because everything's going to clear up on its own. But some clinics actually have you bring the animal back in so that they can remove sutures. Also ask what's provided in the cost for the spay and neuter surgery that they're providing you with. Now, for example, with us, we operate in very low income areas, so we have to make sure that the prices are as cheap as possible. But in other clinics, you might see prices that are a lot more and will therefore include more in the package, such as IV drip, pain meds, and even a cone. So you want to know ahead of time what extra things you might want to pay for and what's not included, because those things can actually make your bill go up quite quickly. First thing to take into account is the administration of IV fluids. So this really depends on your area. Some areas it is a requirement, part of the care, and in other areas it's not part of the practice, so it's not included in the upfront cost. It's something that's going to be charged extra. So an IV drip is basically the same thing that you get when you go to the hospital and they put an IV in your arm and they give you saline to keep you hydrated. So this is something that you can get for your dog or cat when you take them for their spay and neuter surgery. This is provided to them during surgery and basically helps the animal stay hydrated and maintain a good blood pressure during surgery. So this is something that I would recommend for everybody because I would definitely do it. But since we do operate in very low income areas, it's my job to help people decide how important it is for their animal. What I usually do is recommend this for large female dogs and for elderly dogs. And this is because with elderly dogs, they need just a little something extra to help them through the surgery. And with large female dogs, the surgery is actually longer. It takes longer and it's harder on them. So that's why it's a really good option for them. For male dogs or small dogs, even sometimes cats, the surgery is very quick. So they're in and out and it's not such a problem if people aren't able to afford the IV drips. So I hope that helps you a little bit with deciding if that is something that you might need or not. But of course, do consult your vet on this. The other thing is pain medication. So generally the practice is to administer pain medications and antibiotics immediately after surgery. And technically this is enough. But you can also provide the animal with pain medications once or twice a day throughout the next following days after surgery. But this is usually something that you are going to have to pay extra for. Animals are very strong, resilient to pain, and even have a tougher immune system than us. With us, pain can really bring us down and even immobilize us. But with animals, it's not like that at all. They're very good at ignoring their pain and continuing with life. Animals don't focus on their pain. And humans, they get sick and infected so easily. It is such a huge difference compared to animals. But at the same time, these are our pets, and we do want to make sure that they are comfortable and happy. So if pain meds are not included in your surgery costs, you will have to decide if you're going to want to pay extra for them or not. This is a really good time to talk to your vet about it and ask them how the surgery went. If the surgery had complications or took longer than normal, then it's probably a good idea to get your animal on pain medication. But your vet will definitely let you know this and let you know if there is any complications in case there might need to be antibiotics used within the following days after surgery. And then of course you have to think about the surgical cone, that weird thing that goes around the animal's head. So usually that is not included in the cost for the surgery, and it's something that you have to pay for extra. Sometimes if you're going to a clinic that's very expensive, that is something that will be included. Now in this instance, we are kind of talking more about dogs than cats. Typically cats are not going to require a cone for surgery, for spay and neuter. Cats are very good about their wounds and they don't, lick at them or, go after them the way the dogs do. Of course, there are exceptions, but generally it's dogs that need cones after getting spayed and neutered. Now, this is, of course, a case-by-case basis, and you probably know your dog best to know if he's going to constantly be going after his surgical site or if he's going to ignore it. Now, what I've noticed is that with dogs that are very young, they typically tend to ignore the incision site, but dogs that are older will actually look at it more and have the possibility of pulling their sutures. So it is so important that your dog leaves the incision site completely alone, because if they're constantly licking at it, they can actually get it infected, and that will add a whole bunch more vet bills to your cost. Some dogs will even tear at their incisions, and this turns into a life or death situation very quickly. There's even sometimes where dogs do tear open their incision site, and even when they are taken right away to the vet's office, sometimes it's too late. It's not enough to be able to save them. So you really do want to make sure that your dog is going to leave that alone. So you can do that by spending a lot of time with them, by having them wear a cone, and just keeping an eye on them. So I hope all of that helps you get the cost down exactly for what your spay or neuter surgery is going to be, and that way you know all the things that are included in it. So now that you got that out of the way, you need to prepare your cat or dog for their surgery. Now also make sure that your dog or cat is a good healthy weight before making them an appointment. You want to make sure that they're not too overweight or not too underweight, because this can cause complications during the surgery, and it's just not a good idea to put an animal through surgery if they're not 100% healthy. And remember, recovery is going to be a lot faster for a healthy pet. This is a good time to make sure that your cat or dog is up to date on all their vaccines and gets a health exam from a vet. Something that your vet clinic will very much appreciate is that your dog is properly socialized. Make sure that your dog is able to be handled by other people, and your cat as well. If your pet is too aggressive, you may be turned away from the surgery. We have actually had to turn away people because their animal was too aggressive. Dangerous to those of us working at the clinic, and also dangerous to itself, because a dog cannot be muzzled while it's going through the surgery. It has to be able to breathe properly and all of that in order for it to be safe. And it even happens with cats sometimes, because sometimes people will bring in feral cats saying that it's actually their pet when it's not, and it's actually very obvious to tell the difference. Next, please make sure that your pet is clean before bringing them into the clinic. You can give them a bath the night before their surgery, and then also make sure that they're not carrying any parasites. There will be other cats and dogs in the clinic, so please be conscious of those around you. Now, the next thing your vet will tell you, but I cannot express to you how many people don't listen. Do not feed your pet before taking them to the clinic. Your pet should be fasting for at least 8 hours before you drop them off. So don't feed them. This is really important. It actually makes them very sick. So make sure that you don't feed them and take them into the clinic fasting, because a lot of times people don't, and the dog actually does end up very sick. It's just like with us, when we go under anesthesia, we do need to be fasting. Now, when you do drop them off, take them to pee or poop before taking them inside. This is just going to be easier on everyone. As someone who's worked in a clinic, I cannot stress this enough to you. Be on time for your pet. I can't tell you how many people actually leave their pet at the clinic past the hours of when the clinic has closed. So now you did everything to get your pet fixed, and you're picking them up from the clinic. You're not done yet. Now you have to help them recover. First thing is to be sure to follow all of the instructions given to you by your vet at discharge, and then also make an appointment if your dog or cat does need to go back for a follow-up visit in order to remove sutures. It is so important for your pet to ignore its incision site, and like I said earlier, this is more for dogs than cats, so make sure that your dog does not lick, bite, or do anything to their incision site. If they don't completely ignore it, then put a cone on them. So then you want to put your dog into a crate and keep them there over the next couple of days. You can also let them walk around the house, but you do want to make sure that they don't move around a lot. So a lot of people pick up their dog and then they just want to put it back in the backyard, back outside, and that is the perfect recipe for an infection or a hernia. So just make sure that your dog stays clean and that they aren't, jumping around a lot or anything that could open up the incision site or cause for internal problems. It's just like with people. If you go in for surgery, your doctor's going to tell you limited physical activity, make sure you keep the incision site clean, blah, 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 do all of this. It's the same thing for your pet. So make sure that they are safe. And this is kind of something a little bit more for dogs than cats. Cats tend to be better about this. But again, keep your cat inside if your cat is allowed to go outdoors. make sure that they stay clean and a little bit less active than usual. And that's for about the next week. It usually takes about 10 days for an incision site to heal up. The day that you pick up your pet from surgery, they're probably going to be a little bit groggy, and you only want to feed them about half of the regular amount of food. And sometimes they might not want to eat at all. This is completely normal and okay. It's just like with people, anesthesia affects us all differently. We all kind of act a little bit differently on it. So if they don't want to eat, that's okay. They'll be fine. Just, let them rest. They may be a little bit nauseous. You can usually tell if a dog is nauseous because they will be drooling a lot from their mouth. And so if it's more drool than what your dog usually has, he's probably just a little bit nauseous, and it is something that will pass. And then of course you do want to watch out for any complications. So if you see any redness, swelling, irritation, or anything like that at the incision site, be sure to contact your vet right away. So that's about it. Really not too complicated. It's a very routine, easy procedure that animals recover from very quickly. It's just basically knowing everything to do afterwards and before. So I hope that helped you if you decide to get your cat or dog spayed or neutered. And I hope you enjoyed today's video and learned something from it. Don't forget to subscribe, and you can also follow me on Instagram and Twitter. And I'll see you guys in the next video. Bye!